Hi, my name's Emily. I'm going to be your nurse practitioner for today. We're just going to be doing a full, complete health assessment, okay? So I'm going to go through each system and assess you.
Okay.
How are you feeling today?
Very good, thank you.
Good. And can you tell me your name and date of birth?
Julie Finaro, 1759.
Great. And where are we right now?
Doctor's office.
Great. And what's the month and the year?
March 2022.
Good. Patient is alert and oriented ×3. Her posture is upright and comfortable. Her speech is clear. Her mood appears happy and content. And she is alert. Her level of consciousness. Vital signs are as follows. BP is 120/80. Respiratory rate is 16. Pulse oximeter reads 98%. And her heart rate is 80. I'm going to start by testing your vision. Can you cover your right eye for me and read this line for me?
CFDHJ.
Great. Can you cover the other one?
CFDHJ.
Great. Vision is 20/20 bilaterally. And her general appearance is she's well kept, she's well groomed. Everything looks good there. I'm just going to start by checking your scalp, okay? Okay, hair is evenly distributed. No hair loss, no lesions, no lice. Everything looks good. I'm going to start with your eyes. Okay, I'm just going to shine a light in your eye. Good. Pupils are equal and reactive to the light. Can you follow my finger with just your eyes? Good. Pupils are equal and reactive to the light. EOM is intact, as well as accommodation and convergence. Can you look at my nose and tell me how many fingers I'm holding up?
2, 1,
2,
1.
Peripheral vision is intact. Okay, I'm going to take a look in your eye now. Okay, retina is red and intact. Everything looks good. Do the other side. Retina is red and intact as well here too. External eye, there's no lesions, there's no drainage. Eyelids are intact. So is the conjunctiva. Iris is brown and the sclera is white. Okay, I'm going to move on to your ears. Okay, the external ear. There's no lesions, there's no moles, there's no growths. I'm going to take a listen. I'm going to take a look. Okay, there's no blockages. The tympanic membrane is translucent, shiny, pearly gray. Check the other side. The external ear looks good over here too. And the tympanic membrane is also pearly gray and translucent and shiny. Okay, I'm going to test your hearing now. Can you just repeat back to me the 3 numbers I'm going to say? 6, 7, 8.
6, 7, 8. 3, 4, 5.
Great. I'm also going to tell you 3 words I want you to repeat back to me at the end of the exam, okay? Truck, cat, and fish. Got it. Great. Okay. Everything looks good with your ears. Her hearing is intact. I'm going to test you with a tuning fork. This is a tuning fork. I just want you to tell me when I put it on the top of your head if you hear the noise equally in both ears or more in one or the other.
I hear it in both ears equally.
Her hearing is intact as per the tuning fork tests. Okay, we're going to move on to your nose. Okay, both nostrils appear patent. There's no blockages or drainage. I'm going to palpate it. No tenderness noted. Can you close one nostril for me and breathe in? Can you close the other one? Okay, nares are patent. Just going to feel your sinuses. Okay. No tenderness noted in her frontal or maxillary sinuses. I'm going to test your temporal. Okay, they're elastic and no tenderness. Can you move your jaw in and out for me? Good. TMJ is intact. Can you close your eyes for me? Tell me where I'm touching you.
Forehead, left cheek, chin.
Great. Sensation is intact bilaterally. I want you to close your eyes again and tell me what you smell.
Lemon.
Okay, cranial nerve 1 is intact. I'm going to take a look at your mouth now. Can you open your mouth for me? Okay, teeth are all intact. They're white. No bleeding in her gums. Can you stick your tongue out for me and say ah? Uvula is intact as well as the oropharynx. Tonsils aren't present. She had a tonsillectomy. Can you move your tongue back and forth for me? And up and down. Great job. Okay, tongue movement is good. It's midline. Okay, can you smile for me? Can you frown? Great. Puff your cheeks out. Show me your upper teeth and your bottom. Great. Face is all symmetrical. Okay. I'm just going to take a feel on your neck. Okay. Her lymph nodes aren't, I can't feel them. They're non-tender. Neck appears to be symmetrical, appropriate for ethnicity. There's no darkened colors or lesions on it. I'm going to feel for your thyroid. Can you swallow for me? Okay, swallow again. Great. The thyroid is not enlarged and the trachea is midline. I'm going to take a feel for your carotids. Okay, carotid arteries are palpable, and I'm just going to listen to see if there's any bruits. Okay, no bruits are noted bilaterally. Can you just swivel your neck for me all around, left and right? Good. Neck range of motion is intact. Okay, I'm going to move on to your back now. Okay, scapula is symmetrical and intact. Breathing is normal. No accessory muscle use is also symmetrical. I'm going to percuss. Okay, all areas are resonant on percussion. Can you say 99 for me?
99.
And again,
99.
Tactile firmitis is intact. Can you tell me if you feel any tenderness? Okay, no CVA tenderness. And then I'm just going to assess the chest expansion at T9 and T10. Just turn a little bit for me. Great job. Okay, just take some normal breaths. Good. Chest expansion is good at T9 and T10. Now I'm going to take a listen. Take some deep breaths. Great. Lungs are clear bilaterally. You can turn around. Okay, I'm assessing her anterior chest. It's symmetrical. Breathing is normal, even unlabored, no accessory muscle use. Percuss. Okay, areas are tympanic on percussion. Can you say 99?
99. 99.
Great, tactile firmitis is intact. Take a listen. Great, lungs are clear bilaterally. Just going to repercuss. Okay. Percussion is resonant in all areas of the anterior chest. Okay, I'm just going to take a look at your arms now. On inspection and palpation of the joints. They're all intact. Skin looks good. No lesions are present. They're both the same size. They're symmetrical. Brachial pulses are present bilaterally. Radial pulses are present bilaterally. And ulnar pulses are present bilaterally. Can you follow my movement so I can test the range of motion? Good. Range of motion is intact bilaterally. Can you shrug against my shoulders? Good. And turn your face into my hand. Good. Shoulder strength is 5 out of 5. Can you squeeze my hands? Pull me towards you. Push me away. Good. Muscle strength is 5 out of 5. Capillary refill is less than 3 seconds. Okay, can you close your eyes for me? And tell me whether the sensation you feel is dull or sharp.
Sharp. Dull. Sharp. Dull.
Good. Sensation is intact bilaterally. You can keep your eyes shut. I'm going to place an item in your hand. Can you tell me what it is?
Keys.
And what do they do?
Unlock the door. Start the car.
Great. How about this?
It's a pen.
Okay, and what does it do?
Writes.
Great. And then I'm going to write a letter in your hand. Can you tell me what it is?
A.
Okay, and I'm going to write a number in this hand.
2.
Okay, all of those sensations are intact bilaterally. You can close your eyes again. Tell me if I'm lifting your finger up or down.
Up. Down.
Great.
Down. Up.
Good. Okay, that was intact. Now I'm just going to have you going to test one of your reflexes. Okay, so just dangle your hand for me. Good. And on the other side. Good. Bicep reflex is intact. Okay, now I'm going to have you lay down for me in a supine position, so on your back. Okay, just going to palpate your heart. So I'm going to start at the base of the heart, apex, and your left sternal border. Great. I'm going to test for jugular venous distension. No distension is noted on either side. Okay. Take a listen. First, I'm going to palpate your apical pulse. Feels strong. Okay, so I'm listening to the aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, no murmurs are noted. I'm going to listen with the bell of my stethoscope now. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Great. Sounds good with the bell of the stethoscope too. Now I'm just going to have you turn a little bit so you can lie on your left side. Okay, great. Your apical pulse is strong. You can slide back around for me. Okay, I'm inspecting the abdomen. Abdomen looks symmetrical. There's no lumps or masses that I can see, and patient has not complained of any pain. I'm going to palpate. Okay. Right upper quadrant is soft. The liver is non-palpable. I'm going into the left upper quadrant. The spleen is also non-palpable. And I cannot feel the kidneys either. And the abdomen is soft and non-tender on palpation. Okay. I'm going to start listening. Okay, bowel sounds are active in all 4 quadrants. I'm going to listen for bruits, aorta, renal, inguinal, and femoral. Okay, no bruits are present. Okay, I'm going to feel for your inguinal lymph nodes. They're not present. Let me feel for your epitrochlear lymph nodes. Those are also non-present on your bicep. Great. I'm going to feel for pulses, okay? Femoral pulses are palpable bilaterally. Popliteal pulses are palpable bilaterally. Dorsalis pedis and PTs. All the pulses are palpable bilaterally. I'm going to check for edema. Okay, there's no edema present. Capillary refill. Capillary refill is less than 3 seconds on both. Can you push against my hands? Good. How about this way? Good. Strength is good in her feet, 5 out of 5. I just want to check your range of motion. Can you bend this leg for me and extend it back? Good. How about that one? Okay, good range of motion in her knees. Can you put that? Yep, great. And how about with your other foot? Good. Her hip range of motion is also intact. Can you swivel your ankles for me? Good. Ankle range of motion is also intact. Can you, with one heel, run it down your other shin? Good. And with your other one. Good. Okay. There's no ataxia present. Okay. And now I just want to check your reflexes on your knees. So could you stand up and sit in the chair for me? Okay. Great. Okay, I'm just going to check the patellar reflex. So just relax your legs, okay? Good. Good. With that being said, can you go like this for me? Okay, her rapid hand movements are also intact. Patellar reflexes are intact. Then check your Achilles. Hitting the back of your leg. Okay. And relax that foot too. Good. Achilles reflexes are intact bilaterally. I'm also now noting her legs and hair growth is all distributed evenly. Color looks good. Legs are symmetrical bilaterally. Okay, now I'm going to have you just stand up for me. Can you cross your arms over your chest and shut your eyes? Good. Balance is good on the Romberg's test. Can you take a few steps that way for me? Great. And then can you walk back just one foot in front of the other? Good, good tandem walk. And can you hop on one foot? Good. And the other one. Great job. And now can you recall the 3 words that you told me?
Truck, cat, fish.
Great job. So she was able to recall the 3 items. And now lastly, can you just turn around for me? Spine is even. If you could just bend over. Okay, normal curvature of the spine. No scoliosis is present. And then if you could stand up again and just arch your back. Okay, good spinal range of motion. Okay, and that concludes your exam. Do you have any questions for me?
No, I don't.
Okay.
Thank you, Emily.
Great job.